Hi, I'm Dr. Raghu D K, a consultant gastroenterologist at Apollo Hospitals, Jubilee Hills. Today we're going to talk about inflammatory bowel disease. As the name suggests, inflammatory bowel disease is nothing but a chronic inflammatory state of the intestines, gastrointestinal tract. It is usually divided into two different categories. One is ulcerative colitis and the other one is Crohn's disease. What is inflammatory bowel disease and how does it occur is the main topic of discussion. So like I said, it is inflammation which occurs from several different etiologies, although not one specific etiology has been identified. There was thought process in the past that diet and stress play a role in IBD, which is inflammatory bowel disease, but newer theories have been postulated which show that a dysregulated immune response is what causes inflammatory bowel disease. There are some other theories also showing a genetic predisposition, environmental factors, dietary factors also which play a role in developing inflammatory bowel disease. Usually occurs in someone who's less than 30, but it tends to show a bimodal distribution. Someone who's over 50 also has a second peak of incidence of inflammatory bowel disease. Coming to the incidence, ulcerative colitis, as it says, colitis, which is specifically affecting the large intestine or the colon, whereas Crohn's disease can occur anywhere from the mouth up to the anal opening. That is the difference. And Crohn's disease can have skip areas or skip lesions along with transmural or involvement of the entire thickness of the gastrointestinal tract wherever it's affected. So how do these patients with inflammatory bowel disease actually present? They tend to have diarrhea, they tend to have abdominal pain and cramps, blood in the stool, shunted growth, lack of appetite. These are some of the manifestations that can happen. Rarely rash, joint aches, visual manifestations, skin rashes are some of the extra-intestinal manifestations how they can present. So that's as far as the clinical scenario would be. How do you diagnose anyone who has inflammatory bowel disease who come with these specific symptoms? We start off with a clinical examination, examining their belly, examining the stool to see if there's any bloody diarrhea or not. After that, you do some specific tests, blood tests such as a complete blood count, certain inflammatory markers such as ESR, sedimentation rate, a C-reactive protein, which are inflammatory markers, along with some stool tests such as a fecal calprotectin is one of the specific tests. Certain imaging modalities also are used such as initial abdominal X-ray, radiography, ultrasonography, a CT scan of the abdomen, and MRI of the abdomen. And finally, to get tissue diagnosis, we go towards a specific endoscopic and colonoscopic procedures to obtain biopsies of the various parts or tracts of the gastrointestinal system to obtain biopsies. So once the patient with these symptoms comes over, you do those tests, you confirm a diagnosis of inflammatory bowel disease, be it either Crohn's disease or ulcerative colitis, and after that, you tend to go towards treating this condition, which is an elaborate topic by itself. So in a nutshell, inflammatory bowel disease is a chronic inflammatory condition of the gastrointestinal tract divided into two broad types such as ulcerative colitis and Crohn's disease, and several ways to diagnose and investigate these conditions. Thank you.